Hi, everyone, and thank you for joining today's webinar. We are going to be discussing a little bit more about CIVHC and also talking about our evaluation services. That is a new program that we're launching and excited to share with you today. We're going to, as I mentioned, we're going to talk a little bit about CIVHC, more about our organization, and then you'll be able to meet the team of evaluators and learn about evaluation as well as specifics that CIVHC offers through this new program. Just a couple of housekeeping items today. All lines are muted, so you're not able to unmute and speak, but we do encourage you to use the Q&A section. We will be monitoring that and answering questions. We will have some time at the end in order to address those, and we will be recording this and listing it on our website along with the slides, and invite you to review that and share it with others as well. So a little bit about CIVHC. We're the Center to Improve Value in Healthcare. That's the acronym. And we work with organizations to really advance the triple aim through empowering individuals with information, collaboration, and different ways that we do that to really address that triple aim. We are a nonprofit. We want to remain independent and objective so we can be a nonpartisan information source, as well as a good spot for convening efforts in a very collaborative environment. We work with a broad range of individuals from community-based organizations, small nonprofits, large health systems, state entities, as well as large employers and consumers directly, along with lots of other individuals. So these are just a few, and we name them change agents since we empower them to make change in their environments and hope that that change is lasting. We are able to do a couple different things. We offer a lot of public information through use of the all-payer claims database, which I'll talk a little bit more in just a minute. We also do direct data licensing. So if you have a specific question that can be answered with that data, we are able to do that. We do a lot of education and events. And my area is around the programming and convening efforts, and we support a number of different efforts in older adults, advanced care planning, end of life, and palliative care services. And as of now, the evaluation team as well is falling under that service. So what is the all-payer claims database and CIVHC? So it was launched in 2008 with the Blue Ribbon Commission, and it was really launched to be an organization that really brought people together and tackled challenging issues. In 2012, we were appointed as the administrator of the all-payer claims database on behalf of the state Medicaid department. And so we were entrusted with this large source of data that has a multitude of claims in it, and are allowed to share that information and are encouraged to provide that to public and also other change agents to make use that data in a really useful and effective way. So what's in there? We have over 870 million claims. We cover lots of different pay sources, including Medicare, Medicare fee-for-service, Medicare Advantage, commercial plans, and Medicaid. We have over 5 million covered lives, and we have about 70% of the Colorado covered lives. There are a few things that are limitations in the all-payer claims database, and that includes some of the federal programs, VA, TRICARE, and Indian Health Services. We also don't have many of the ERISA-based plans, although we are working with some of those organizations to incorporate that. And we don't have any of the self-pay information. So if someone pays for services cash or some sort of cash type pay, we don't have that information because it doesn't come through on a medical claim. So now I want to turn it over to the evaluation team and talk a little bit more about the evaluation services.
If you can go to the next slide, please, thank you. Hi, good afternoon, everyone. I'm Ben Hochschild. I'm the Evaluation Program Manager here at CIVHC. So as we have seen in the email registration, the evaluation team is a new addition to CIVHC, and we are a small team, but we do have a lot of support. We're advised by several senior staff here at CIVHC, including Carrie DeGurnis, Maria de Jesus Perez, Paul McCormick, Kristen Paulson, and Martha Meyer. And although we are a small team, CIVHC has several teams and a wealth of experience and expertise in data analysis, biostatistics, research, policy, and communications, among other things. Now I'm going to turn it over to Val to introduce herself, and she'll be giving an overview of what evaluation is.
Hi, everyone. Thank you, Kari, and thanks, Ben. So as Ben mentioned, we have a lot of power and capability within the data that Kari just gave an overview of. And we see a lot of value for helping our change agents evaluate the work that they're doing. But before we get into talking about how to apply the all-payer claims database for evaluation, we want to make sure that we're all on the same page about what we're talking about when we say evaluation. I think it's a term that we all use a lot, and we all have a basic understanding of it, and it makes sense on the surface, and then it gets really confusing really quickly. So I'm going to jump really quick into a primer on evaluation and why we do it. And a little bit of how we do it. So evaluation is a type of research. So it's very systematic, it's methodical, and we use measurable feedback to study programs, innovations, practices, interventions, that sort of thing. And the reason we do evaluation is it can really guide us through every step of our programs and projects. So we can use them to assess needs and identify what projects need to happen in the first place, and use that information to inform our program design and how we're going to implement that program. And then we use evaluation techniques to monitor progress as we're implementing toward our goals. So we can see, are we achieving what we're trying to achieve? If not, why not? Do we need to tweak something? And that gives stakeholders powerful information to tackle problems early. And then, of course, we can demonstrate any intended or even unintended outcomes and impacts of the work that we're doing. So we can make sure, did we reach our goal, and is it having a broader impact? So in short, evaluation is used to inform decision-making about where to invest. So we all know that the programs and innovations and projects that we do require a lot of time, money, effort, numerous resources, and we want to make sure that those resources are going to the most effective projects and we're achieving our goals. So I mentioned before that evaluation is a type of research, and I want to frame evaluation in the context of research because I think people tend to have a little bit of a better understanding of what research is. So just a quick overview, research is typically hypothesis driven. We're trying to observe and learn about something, and so we have a question or we have a theory about how something works, and then we're going to test it and just see what happens. So for example, we have a condition in the community, there's a new drug developed for it. Does that drug work? Clinical trial. It's a very methodical approach. And the purpose of research is to make research recommendations, whether it's conclusion about, yes, this works, no, it doesn't, this is what happens when you make this change, or here are additional questions that came out of this work. And it's typically communicated through peer-reviewed publication. And it's important to note that for most research, the results are typically generalizable. They should be replicable in other communities and situations. It is a fact of this happens when this happens. Evaluation as a subset of research is really focusing on specific objectives and is outcomes driven. So we know we have this drug that works. We've done the research, we know it works. And we know that our community population has this condition that could be treated by the drug. So we want to implement a program to distribute that drug. An evaluation might look at, are we equitably distributing this drug to the patients who need it the most in our community. And so it's really focused on that objective. Are we getting the medication where it needs to go? The purpose of evaluation is more customized and focused on making practice recommendations. And as a result, it's typically communicated in a report to stakeholders. And there's often a lot of back and forth, a lot of regular check-ins and interim reporting as well. And as you can see in the middle, evaluation uses many of the methodologies that we use for research. So here's a quick example of how close but slightly different research and evaluation are. So let's use an example project. Say a city wants to strategically allocate its limited inspection resources to improve community health. So a city does rental housing inspections. And this is an example from work I've done in my past life. And so what we did was we kind of had two steps to this project. We had our research base, where we wanted to observe and learn. We wanted to know what was happening in our local community and also what the national data says and what the research says about the relationship between housing and health. So we identified what the primary community health outcomes of concern were, and we also researched housing conditions that are associated with those identified health outcomes. So a great example with that would be poor housing condition can often exacerbate asthma. And then we also looked at national housing condition indices. So there are many indices out there that give examples that estimate the quality of the housing based on certain housing conditions. So that was observing and learning. Then we move into the evaluation phase, which is really looking at assessing the information we got from our research and using that to inform decision-making. So for this project, we adapted our indices to match the local codes. So there were exact relationships because local municipalities have slight differences in their codes and how they check for conditions. We reviewed and confirmed our adapted indices with key informants. So we conducted focus groups and key informant interviews. And then we applied that new index to our inspection data, and we identified census tracts throughout the city where they had high areas of housing code violation, as well as high rates of poor community health. And being able to identify those specific tracts, we were able to recommend to the city, if your resources are limited and you need to allocate which inspectors focus where, you may want to identify these tracts specifically and send more inspection folks in those areas. So that's one example of a project that uses research and evaluation to improve a process or a policy or a program. So I mentioned before that evaluation really helps us at every stage of our project. And to that end, there are many different types of evaluation. And I know this slide is messy, so I will walk through each stage. But these are the basic types of evaluation. We have formative, process, outcome, and impact. And most people, when they think about evaluation, jump straight to impact. We want to know, what was the outcome and how did we make a difference? But all these other types of evaluation along the way really help to inform the quality of the program that can lead to ultimately identifying that impact. So I'm going to break it down using a hypothetical example. So imagine that we want to implement a parenting program to improve graduation rates in our city. A lot of us on this webinar have a health focus, so we know that educational attainment is highly correlated with health outcomes later in life. So maybe we're noticing that we have low educational attainment in our city, and we really want to focus as young as possible to build that foundation to improve health in the long run. An impact evaluation of seeing that health improvement in the long run is really, really complicated and difficult, but there are many steps along the way where we can show other improvements. So for example, we'll jump to the formative evaluation. When we do a formative evaluation, we decide, what are we going to do? Why will we do that thing and how? And so I actually kind of skipped ahead because we've already chosen, we've done the research, we've decided we need a parenting program. So that's part of your formative evaluation. But then you can go deeper with that and really use that to inform your program design. So you can look at your methodology. So we know we want a parenting program. There are numerous curricula out there, all with their own benefits and merits. And we really need to look at studying which programs are out there and which best fit our community. So let's imagine that we've gone through that process and we've selected a parents as teachers curriculum to implement for our project. Then we want to look at the impacts, or I'm sorry, the inputs. So what staff will we need? How many staff hours do we need to conduct this work? Who needs to be trained? What will all of this cost? How do we keep the lights on while we're doing this? How do we drive to our parents' homes to do those home visits? So really thinking about what are all of the elements of the project that are going to go in this? What's our project timeline? And then the huge reason why we're here is also looking at what does success in this program mean to us? And how will we know if we've succeeded? So what are the things that we're going to measure so that we know when we look at that number that we succeeded? And we're going to use that to determine the measures and build an evaluation plan to go along with our program implementation. And I just want to note, many people on this call have probably been involved in conducting a needs assessment. That is a very common example of a type of formative evaluation. So you've already done that. Okay, so we've decided what program we're going to do, and we're going to implement it. And as we implement, we're going to do process monitoring. And so really we had decided before what our measures are going to be. Some of those measures will be process measures, and that's going to be data that will help inform how are we doing with the implementation of this project. So did we follow our plan? What worked well with our plan? What can be improved in our plan? So following our parenting program model, the Parents as Teachers curriculum has a very strict model that groups should follow. And are we practicing that model with fidelity, or have we had to make changes? And if we've made changes, why have we made them? Does that mean we need to adapt with perhaps more staff training, or does that mean perhaps we had to add or remove something because it wasn't relevant to our community? Also looking at simple measures such as we said we were going to do 6 trainings, but we only did 4, or hey, we did 10 because we had way more interest than we thought. So really looking at the performance of the activities that you're doing and the actual inputs and costs. And one example of this is also you want to make sure that you're reaching the populations that you've identified as the greatest interest. And if you're not, that indicates an adaptation to the outreach process. Also, while we are working through implementing our project, we're collecting outcome measures. So we're monitoring data that tells us, did our activities have the expected effects for those who are participating in our program? So are we seeing an increase in parent knowledge, involvement, or even if we're collecting feedback surveys at the end of the program, did participants find the program valuable? And some may argue that that last bullet could also go under process monitoring. These are flexible, there's not strict rules. And then last, we get to impact evaluation. So this is a much longer term, more in-depth study. And the goal is to identify the intended and unintended long-term effects of our program. And I do want to note here, I mentioned before, the impact evaluation can be very difficult, showing the association between your program specifically and the outcomes that you see in the community. But there are many ways to do this, and this is one area where the Colorado All-Payer Claims Database really comes into play, because many of you may have access to your own data, but do not have access to other programs or the state as a whole. And so the data that we have available in the All-Payer Claims Database can really help you look at outcomes for patients across the state that can help inform. And even if you're a clinic or a hospital system, you may have your own data, but due to privacy concerns, you won't have access to other systems' data. So we can build out parallel cohorts of patients who are similar to your patient population to do comparison studies. So going with our parenting program example, we may want to look at, is Parents as Teachers spreading throughout our community? Is there more interest in funding this program because of its success, et cetera? We could also look at impacts such as, are we seeing changes in grade level reading and math and graduation rates in the communities where we're implementing the program? So that's just one example of how evaluation styles and techniques connect across the lifespan of your program to really make sure that it is operating at highest efficiency and highest quality to make sure that you're having the biggest impact for your investments. So 2 quick examples of past projects that Civic has done as evaluations. And so these are examples of ways that the all-payer claims database has already been used. And the reason we're implementing this new team is we see a lot of value in expanding these kinds of projects and supporting our change agents in these evaluation studies. So the first example is Project Angel Heart, which is an organization that provides customized home-delivered meals free of charge for patients who have chronic medical conditions that can be better managed through a healthy diet. And so examples would be patients with diabetes, COPD, and heart disease. So Project Angel Heart had anecdotal data about the value of this program. And when they started out, they were grant funded, and it was very difficult to continue sustaining that funding model. And they really wanted to show we have a really strong impact and there's value here so that they could reach out to potential funders. So they worked with Civic to use claims data to look at the healthcare cost of clients who receive these medically tailored meals prior to, during, and after delivery. So kind of a pre, during, and post, and comparing them to a control group. So I mentioned that we were able to create controlled groups of similar patient populations. This analysis demonstrated that there was a significant reduction in hospital readmission. When patients were hospitalized, the cost of those stays was over $500 less. And the total per person per year cost for participants was much lower. And so they were able to demonstrate when patients have these medically tailored meals, that really improves their overall care and quality of life and reduces their medical costs. And insurers and funders see the value that was proven with this data to the point where many are now funding this program for their own members. So they were able to use these findings to sustain this program with dedicated long-term funding. One other example is Civic has conducted out-migration analyses for change agents. So these, you may be a member of a hospital facility, for example, and you know your patient population, you know what services they're accessing at your facility, but you may not know how the patients in the community are accessing care in other ways. So where else do our patients go for care? And this can inform things such as when you're determining where to invest resources, you may look at your patient population and say, oh, look, we have multiple patients traveling 100 miles to facility B for blood testing because we don't have that in our community. This is a service we can build in and offer to improve access to care. Another option is when you're doing an analysis and market research within your community, you can identify what your market share of certain services are and really understand how many other facilities in the area provide this service, what is our proportion that we're serving, that sort of thing. So it can be really informational for both planning and business decisions. With those examples, as I mentioned before, Civic really sees the value in expanding this type of project, and we want to provide these services in-house because we recognize that many of our change agents may not have the resources or the expertise to conduct this on their own. And so we've built this evaluation team, and now I'm going to turn it over to Ben, who will talk about what we can actually do for you.
Thank you. So I'm going to be speaking about how data housed in Colorado CPC can be used in evaluation and some examples of the types of evaluation services we can provide. So Civic is uniquely positioned to provide evaluation on healthcare utilization and costs in Colorado because of the centralized Colorado All Payers Claims database. In addition to the claims data that's held within the COAPCD, data from sources like the American Community Survey, the census, and other data can be used to create a richer picture of community health throughout the state. We're able to use data at the census tract level to determine a social vulnerability index that can be used as a measure of community health needs and can create community profiles when individual level data like race or ethnicity, income, education, or other individual level data is missing or unavailable. So additionally, quality measures are included and can be used for composite measures like creating a composite diabetes measure that could include testing for A1C, screening for diabetic retinopathy, nephropathy, and a completed diabetic foot exam. Recently, just in the past year, we geocoded all of the data within the COAPCD, and that allows us to conduct more comprehensive geographical analyses than before internally and provide more data than we could previously. In the past, we could estimate the distance between a patient or a client and a service by comparing a patient's location from the center of a census tract and the distance to the center of a census tract where a clinic is located. But those estimates were pretty imprecise and were based on a linear distance from one point to another. And they could underestimate the actual distance someone, particularly those in rural areas, may have to travel for service. So if you can picture driving through the winding mountains of Colorado roads to reach the clinic, you'll have an idea of what the issue here is. With the geocoded data, we can actually calculate drive time distances from one location to another and then present an aggregated picture, such as the median drive time for patients for a specific clinic, hospital, or facility. So the APCD allows us to ask questions about things like differences in patient demographics, healthcare trends, such as when and where services are accessed. And it allows us to look at healthcare utilization. And of course, with claims data, we can look at costs and conduct analyses like return on investment, cost effectiveness, or cost benefit. This slide is an overview of the types of evaluation services we're able to provide. Starting from project planning, we can conduct a needs assessment, we can prepare logic models, we can design surveys and create evaluation performance and measurement plans to track what's being measured and evaluated. We're also able to provide analytical services like summary data analysis or more complicated statistical analyses, cost analyses, qualitative data collection and synthesis, and we can conduct individual or group level qualitative activities like surveys, key informant interviews, and focus groups. In terms of a final product, we can prevent evaluation data back in a number of ways. This could include a complete evaluation report, the creation of infographics like charts, graphs, or tables, maps that you could use on a website, and a slide deck, or in other materials. We can create custom slide decks summarizing the entire evaluation process and results that you can present internally to staff or to an executive team or externally to stakeholders. And we can develop toolkits for ongoing monitoring and measurement of data. But we're not just limited to conducting full-scale evaluation. If there is a need, we can provide capacity building assistance and training around data numeracy and understanding and using your own data and other data sources. So now we'd like to present a few potential use cases where using data from the COAPCD can help your program evaluation. If you're a funder, for example, you may ask what the impact of your funding has had on access to and quality of care or cost. We can design and evaluate programs using claims data to assess outcomes and answer those questions. Or if you're planning to fund multiple nonprofits or community-based organizations through grants or another mechanism, we can partner with you to include an evaluation as a component of your grant requirement. We can also provide evaluation guidance to applicants and grantees and technical assistance in collecting, analyzing, and submitting data. So we could potentially host a webinar for potential awardees or grantees and bring them up to speed on that evaluation section. If you're a nonprofit or a community-based organization, you may want to know how effective your program has been. We can partner with you to perform an evaluation of your program's processes, outcomes, and impacts. As Val mentioned, impact evaluation can be notoriously difficult. If you have a community health program on chronic disease prevention, for example, you can use your data to count how many people were reached, but gauging the impact can be hard. If people are going to different clinics and hospitals and you don't have access to patient outcomes, that's going to limit your ability to evaluate impact. But using data from the CIVHC, it's possible to look at the area where you're providing prevention services. We can see if there's been an impact on things like access to care. Using a composite measure like the diabetes quality indicator, we can look at hospitalizations or rehospitalizations, and that's just some of the measures we can look at for impact. And as mentioned earlier, we can provide data numeracy, education, and data use training. So if you need assistance with writing an evaluation section for a grant, we can help make sense of the evaluation requirements and help you build an appropriate evaluation plan for a grant application. So hospital centers, hospitals, and clinics, for clinical settings, you may want to see outcomes on patient data by patient type, payer, and geography, or see if a new approach you've adopted works. You likely already have access to your own clinical data, but you can also use claims data and other data to assist you in identifying access and gaps in care. We can partner to evaluate new approaches to care and care coordination, and we can conduct community needs assessments and make recommendations to improve your services. So all of these are options that Civic can assist you with. Val presented the continuum of evaluation services. Not all of those steps need to be done in that order. A lot of times a formative evaluation isn't necessary, and we'll go straight to an outcomes or an impact evaluation. It's really a menu of options. So also, even if you already have data, but maybe you currently lack the capacity or the staff to fully evaluate your program, that's somewhere where we can help. So now we would like to open the mics and let people ask questions. If you've sent questions in through the Q&A, we can respond to those. Or if you want to ask a question now, please raise your hand and we're happy to take questions. Give people a minute if they're typing questions.
Ben, we have one question come in regarding the process for getting started with Civic.
Yes, I just saw that. Okay, yes, thank you. So there are several things we can do. The process for starting an evaluation project and partnering with Civic to evaluate a program is basically we would set up an initial meeting where we would want to get ideas about what your project is. We want to find out what the outcome of interest that you're interested in finding out is. We want to know what your time frame and potentially what your budget for the project is. And then we'd send a short list of potential project ideas, including what types of evaluation we'd propose, what outcomes we would recommend looking at, and what data sources we'd use and what we might need in terms of data from you. When you've had a chance to review those proposals, and if you've narrowed it down to one project plan, we would then probably prepare a scope of work describing the entire evaluation plan and send that back to you along with a budget for you to review. Once that's agreed on, we would be able to start the process. And we would want to discuss what type of deliverables you want. So whether it's a report, a slideshow, maybe a dashboard or infographics for your website. This can all be very flexible. So if you have an idea, we can discuss turning any of these things into a deliverable.
Ben, we had another question come in about can our clients link their patients to the Colorado all-payer claims database, and how would they do that? So for example, if an organization provided a finder file to us, could we actually compare their specific population to others?
Yes, that's something that we can do. So our data analytics team, frequently for projects that CIVHC already does, people will provide what is called a finder file, and that will match patients in their data set to the APCD so that we can pull measures from the APCD out. So if you're looking at a specific patient population, that's an area that we can do an evaluation on. So there's a question, do you have funding resources that you can refer direct nonprofit organizations and or potential clients to? Funding resources, do you mean funding for grants or funding for evaluation services? If you're talking about funding for grants, that's not something that we have, but that's something that
Ben,
we
you want me to-
can, maybe somebody else can answer.
Yep, I'd be happy to step in. Thanks, Ben. So just a couple of resources that CIVHC has available. If you're looking at a grant application, we can work with you to develop the, if you're looking at the evaluation section to have support with, we can work with you to develop that plan, submit for that grant, and provide a letter of support to send along with that grant that you're going to hopefully get. And then we can begin services whenever that is awarded. Additionally, we also, we also have a scholarship fund that is available for both requesting data sets through CIVHC as well as the evaluation services. This is something that's refreshed annually, and we use the funds throughout the year until those funds are used up. But it's a great way for smaller nonprofits and other organizations with limited resources to access these wonderful services. And we want to really be able to help organizations use data and make the most of their programming efforts. So that is an additional service that we do have available here.
Thank you, Kari. Wanted to make sure, did anybody else have any questions that they wanted to ask? I see a question, how do meaningful use and IRB requirements work with your project planning? So if you're at an institution that has an IRB and you propose a project, you will have to work with your internal IRB. That is something that we can assist you with, but it is not a requirement on CIVHC's part that you go through an IRB. Because what we're providing, especially in evaluation, is de-identified aggregated data. We're not providing data sets. We're providing a summary and outcome data.
If you don't mind, I'd also like to take a step back to the previous question about funding resources. I know Ben mentioned this earlier, but I also want to say again, one thing we can do also is if your organization is applying for a grant and there's an evaluation section, many times that section can be unclear in terms of what the requirements are. You may need assistance developing that plan. That's also a service that we can provide to help make your application stronger.
Maybe I could just ask a question to those on the webinar. How many people have applied for a grant and had an evaluation section as part of a component? If you just could quickly in the chat, just type, I have, or yes. I see some. Yeah, so sometimes, and I have in the past written a lot of evaluation sections for grants. They're not always the same. They're not always clear. Something that CDC frequently does is works with a contractor to specifically handle the evaluation section of their grant application process. And that's something similar to what we're proposing as an offering. So if you're a foundation and you're going to fund multiple community-based organizations or nonprofits for a project, and you write an evaluation section into your grant requirement, we can work with you, we can partner with you, and we can set up a webinar where we can walk people through what's required of the evaluation section in the application. And then after you've made your awards, we can work with awardees on a regular basis to walk them through how they're collecting data and how they're submitting data. So if I'll give it a second to see if anybody else is typing messages, but if there are no more messages, I want to say thank you to everybody. On this slide that's up right now, you see we provided our contact information, and we encourage you to reach out to anyone on the evaluation team with questions, or if you'd like to set up a discussion about a project idea you might have, please get in touch with us. We're happy to talk. We'd like to thank everyone for joining us today. The video for this webinar will be posted on our website, www.civhc.org, that's CIVHC.org. And thank you, everyone.